I'm going to show you a couple techniques that you can do to help your hands, wrists, and forearms feel a whole lot better. All right, you want to make sure you have your deep blue rub. Stuff is amazing. Rub that all over your forearms and your elbows. We also have the deep blue stick, which is on sale this month, and the deep blue oil, which is amazing, and that is our product of the month this month. So if you want information on that, let me know. So rub in your deep blue oil. So first, stretch your wrist back. Grab all your fingers and just stretch your wrist. Get a nice stretch in that forearm and in the hand, and then stretch your wrist forward, flexing it underneath the forearm, pulling the fingers back, getting a nice stretch through the hands. Stretch each individual finger. Rotate your wrists. So grab your thumb, make a fist, rotate in both clockwise and counterclockwise directions. Do flexing, do extension and flexion in the wrists, up and down, pointing the fingertips to the ceiling and then down to the floor, keeping the elbows straight, getting some motion in there. And then another thing I like to do is I'll use my right arm and palm facing up, my left elbow. I start at the elbow with my left elbow, and I gradually work my way down the forearm with the bone in my left arm. So you're just gradually bringing and you can come all the way down onto the hand too, which feels pretty good. Of course, be careful if you have any injuries. Don't do this, but it feels really good to help loosen up the muscles. And if you have the flexibility, flip your hand the other direction and work your way down the forearm over the top of the arm, all the way down onto the hand. Do this as many times as you need to. Get it nice and relaxed. I like to do it about 8 to 10 times. And you can do this every day. Get it nice and loosened up. If you type a lot, if you lift weights a lot, if you're always, if you're driving a lot, anything that can cause you some forearm and wrist pain. As a massage therapist, this is always something that I like to do. Definitely do both sides. You're going to want to stretch that left hand too. We already did the right, so stretch the left hand. And this is something you can do on a daily basis, like I said. And if you find really tender spots, you can kind of stop and do little circles with your elbows. You might see your fingers flex a little bit as you do it. Find the little spots that are sore. Do little circles. If you're getting any numbness, zapping, or tingling, then lighten your pressure. We don't want to cut off circulation. We just want to help the muscles to relax. So another thing I like to do is flex and extend my wrist as I'm pressing down on the forearm with my other arm, and it'll kind of allow glide and an active release, which always feels really good. So do that on both sides. Flex and extend as you glide down the forearm. You can also grip your forearm and twist a bit, just releasing that fascia and connective tissue, bringing your hand up and down the forearm, all the way to the elbow. Both sides. Don't make it painful. Just make it feel good. Another great thing you can do is if you have a double sink, fill one side up with ice water. Fill the other side up with hot water. Dip your forearms and your hands in the ice water for as long as 5 minutes if you can handle it. Start with a couple if you can't, and then dip it into the hot water. It doesn't have to be, don't have it too hot. Have it to where it's okay for your skin. Dip it in the warm water for 5 minutes, and then change. So 5 minutes cold, 5 minutes warm, 5 minutes cold. And I like to end with the cold, and that really just helps to restrict all the stagnant fluid out of the vessels and gives you back a good amount of range of motion. You might feel a little frozen at first, but give it some time and your hands will feel great. So try this technique every day for a week and let me know how you feel. Thanks for watching.